Hello and welcome to NextGen. My name is Wendy Coots. I'm a Senior Sales Applications Specialist. I am a nurse practitioner by trade and have practiced in internal medicine for 11 years, and I've been a NextGen EHR end user as a nurse practitioner as well. I've been with the company now for 3 years. I'm going to take the next little bit just to provide you with what I call the Provider Day in the Life demonstration. I'm going to start by giving you an overview, orient you to the layout of our EHR, and then I'll go into my workflow. I'm going to see a couple of different patients and document an acute visit or chronic condition visit so that you can see the flexibility with which we offer you in NextGen to document, as well as the ease of prescribing, refilling medications, placing orders, adding assessments to your encounter. As well, I'm going to incorporate at the end our Complementary mobile application so that you can see how you can use that as an extension to the EHR. So let's get started. I'm in our NextGen EHR. Just to get you oriented, this here is called the inbox. This is what I refer to as my Grand Central Station. This is where you're going to see your appointments for the day. This is where you will have clinical tasking. That might be refill requests. That might be phone calls for you to make. And then you've got a provider approval queue. That's where your notes for the day will be for you to sign off on. Lab results, diagnostic testing, things that get faxed in to you that you need to review and sign off on. Those will be in the provider approval queue. Up top, you have icons here. These are security driven, and you have user preferences with which you can put those icons in the order that you want them to appear up top, and you can make them large or small. I have mine set to large. Now in the inbox, I do refer to this as my Grand Central Station. You'll hear me say that numerous times because in between each patient, I come back to my Grand Central Station to see where I need to go next. Is there another patient ready for me to see? Do I have a minute to jump over here to clinical tasking and see if I can take care of a phone call, see if there's any refills that I need to address, or do I have a minute to jump over here to the provider approval queue to review lab results and sign off on those, review diagnostic testing, or sign off on my notes? So Grand Central Station, it lets me know where I need to go, what I need to do next. Regardless of which of those tabs you're on, anytime you have a patient highlighted, you're going to see a summary screen. I can see any alerts that this patient might have. I can see appointments. I can see the last handful of appointments that are in the past and those that are scheduled in the future. I can see if there were any no-shows. I can see her allergies. I can see her master problem list. I can see her medication list. And another big thing that I love about NextGen is that I can see lab results. I don't even have to open the chart. The lab results are right here on my Grand Central Station. If I want to have filters, if I want to filter down to just her labs that are pertinent to diabetes, I can filter them down. I can go and graph so that I can trend and see how she's doing. Next, as we continue to talk about the lay of the land, the layout of our EHR, I'm going to open a patient's chart and continue to get you oriented. You'll see that when I open a chart from my Grand Central Station, it opens to my SOAP note. That's where I live. That's where I do my documentation. We're going to talk more about that here in a moment. Continuing with the layout, I have a patient information bar up here. I can see demographics. I can see her insurance. I can see whether or not she's enrolled in Portal. She's not. We've sent her an invitation, but she hasn't accepted it yet, so I might want to talk to her about that. I can see her preferred pharmacy. I can see those same hover buttons with her allergies, her problem list, her medication list, those lab results again. Don't have to dig for them. They're right there for me to review, and I can trend. And another button that I want to point out is called Data Share. We offer the ability for you to query across the country with our interoperability network, which means sharing data about your patients. we allow you to do a query so that you can see if your patient's been seen somewhere else since you saw them last, or maybe it's a new patient coming to your practice. This allows you to have continuity of care. It's going to provide you a continuity of care document. For example, those times a patient comes in and says, hey, I was seen in the emergency room the other day and they told me to follow up with my primary care provider, you'll be able to do a query with our data share to get a continuity of care document. And when I get into my workflow, my provider day in the life, I'll show you how that's incorporated. Next in our layout, patient history here. This allows you to see all of the encounters, all of the patient's encounters across specialties. Maybe you have multiple specialties in your practice. Maybe you have behavioral health. Maybe you have ophthalmology, etc. You're going to be able to see encounters across all specialties here for that integrated chart. You do see them in reverse chronological order. Here's the encounter that we're going to work on today with Miss Branham. You also have a categories tab. Instead of having to flip through each of those encounters, if you want to go to that last chart note, you can come right here to categories and open up that note and review it right there at your fingertips. You don't have to go digging through the encounters to see that. One more thing to point out here is that you have icons at the bottom, similar to the icons up top. It's user preference. You can configure here if you want to have any of those icons down here at the bottom as well for ease of navigation. Now I do want to introduce to you this navigation bar up top. This is the workflow for the care team. Nursing or MA is going to room the patient. They're going to work from the intake tab here. Their intake tab looks very similar to your SOAP note. They have reason for encounter to document what the patient's coming in for. They have vital signs. They have history summary where they can review and update past medical surgical history, social history, family history, diagnostics, for example. They have a review of systems card if you have your clinic support staff to help you by documenting review of systems. They have an allergy card to document and update, reconcile allergies. They have a medication card where they can review and reconcile medications. There's pediatric screening for your pediatric population where they can do the various screenings that you would have them to do, vision, hearing, PPD, PHQ, the ACE-Q, developmental screening. That's all part of the intake here. And then there's an orders card that they can use to reconcile orders or place standing orders. Maybe if it's a patient that's coming in with dysuria, concern of urinary tract infection, they can go in and do those point of care tests from here, etc. So that is the intake screen. Just to point out that each user can put those cards in the order that they want them in, and they can set up whether they want those cards open or collapsed when they come in to room a patient. So I'm just going to uncheck those so that you can see that having the cards open here, all part of the user preference. Then the nurse or MA or your clinic support staff is going to generate an intake note, which is going to give you a nice summary to review of what the patient's coming in for. Then you, the provider, you're going to live on the SOAP note. Looks very similar to the intake note with the addition of a few things. You've got that review of reason for visit, that history summary, review of systems, the vitals, physical exam, assessment and plan, and the medication module. And you too have the ability to put your cards in the order that you want them in. You can designate if you want them collapsed or open. You'll see here in a few moments when I get started in my day in the life and start seeing my patients that I'm going to have my cards opened. And one more thing that I want to point out before I get going is that you also have the ability to view the last note. I can see the last note right here, and you're able to adjust these windows. And we've got it in the format of APSO instead of SOAP so that you can see that assessment and plan right at the top and see your orders, and then go down to history of present illness. And as you're documenting today's note, you'll be able to see your current APSO. All user configurable as to how you want to see your screens here. So that gives you a good overview of the lay of the land. I'm now going to get started with my day in the life. So here we go. I'm logged into the EHR. It's the beginning of my day. I'm in my Grand Central Station, and I'm ready to go see Miss Winifred Carpenter. She's in room 2. She's the next in line for me to go see. I've got my summary that I can review here. I'm going to launch her chart, and it's going to open me right to my SOAP note. Here's my SOAP note. Earlier you saw everything collapsed. I like to keep my cards open. Here's my reason for visit. I can see the comments that nursing made for me. She's having symptoms of a UTI. It started yesterday. She actually called my colleague on call last night who said she needed to come in and get a urine culture. So she's here to be evaluated for that. I can also review the intake note that nursing generated for me when they roomed the patient on their intake tab. Seeing those comments that I just read, and I can see that urine dipstick. She does have blood in her urine. She has positive nitrates and moderate leukocytes. So she does have a urinary tract infection. What I'm going to do is, I see urinary tract infections all the time. I have a large female population. I ask the same questions every day, every time. Do you have pain, burning, frequency, or urgency to urinate? Any nausea, vomiting, fever, chills, low back pain, etc. So what I have and what I use is called a quick note. Before I apply that quick note, I just want you to see my blank HPI, my blank review of systems here, and my blank physical exam. So now I'm going to pull in that UTI quick note that I have. I use quick notes where it makes sense. Different problems that I see on a regular basis: abdominal pain, well child visits, annual exams, UTIs, upper respiratory symptoms, etc. are examples of when quick notes really can help streamline my documentation. So as I pulled in that quick note, it pulled in my standard HPI that I document, my standard review of systems that I document, and my standard physical exam. So now I can go and chart by exception. So her symptoms have been going on for a day, so I need to come in and update that. And in addition to having pain, burning, frequency, and urgency, she does have some flank pain, so I'm going to go ahead and update that. I'll review the review of systems. I don't see anything that I need to update here. My pertinent positives are in bold font with a yellow icon here. Here's my standard physical exam. She does have a little CVA tenderness. The normal that I have documented in my standard exam here is no CVA tenderness, so I do need to go and chart by exception. So I'm going to launch here, drill down into the abdominal exam, and show that she does have right CVA tenderness, and I will update that quickly. I'll come down to my assessment and plan. I already had my assessment attached to that quick note, and I had my standard instructions of drinking plenty of water and or cranberry juice, staying away from caffeinated or carbonated beverages, etc. All of that has already pulled in for me. Now, the nurse did get the urine dipstick, so now I am going to go and prescribe her some Cipro. I'm going to give her Cipro for 3 days because I know she has an infection, but I don't want her to suffer while I wait for that culture to come back. So I'm in my medication module. I launched it straight from my SOAP note. I'm able to save my favorites, or the meds that I prescribe on a regular basis, as well as define their quantity to dispense and number of refills. So I have Cipro here already spelled out for 3 days to give 6 via e-prescribe. Her preferred pharmacy comes up. I'm good to go. I'm going to send it, and then I'm going right back into my SOAP note. Last thing I need to do is finalize the note. This is where the system is going to incorporate those new CMS, AMA, E&M guidelines that came out on January 1st based on medical decision making or based on time spent with patient. This was low complexity. It's a 99213. I'm in agreement with that, and I'm going to submit her code to practice management. And in the real world, my note is going to generate in the background, but for this demo, I'm going to go ahead and generate it live for you. So here's my note, the HPI about her UTI symptoms, her problem list, her reconciled medication list that the clinic staff reconciled for me, review of systems, instructions that I gave her, as well as that medication that I sent her home with, the Cipro. So I'm finished with her note. I'm going to sign it. I'm done with it, and I'm going to close my chart, and I'm going to go back to my Grand Central Station to see my next patient. My next patient is Miss Emily Branham. Brings me to my SOAP note. I'm going to review the intake note that nursing created for me. She is here for her chronic follow-up for diabetes, hypertension, hyperlipidemia, and depression. She needs refills on her medications, and she reports that she's been to urgent care in the last month for diverticulitis. So actually, this is going to be a place where I might look at data share. Data share can be ran in advance, automatically in advance of appointments. Also, it can be ran on the fly. Here, a continuity of care document has returned. I can open that up and review it. In NextGen, we have a nice custom view that has a nice legend over here on the left for you to navigate. If I come to encounters, I can see that she has been seen 3 times since January of this year. We're now into August for diverticulitis. So I see those 3 encounters. I can come to her medication list, and I can see that each time she was given Cipro and Flagyl. She's finished the Cipro and Flagyl that she was given when she was seen back in July. I can come to results, and I can see her lab results. Back in January, she had an elevated white blood cell count. She's had an elevated white blood cell count each time, so I'm able to review those lab results. Other information that comes in the continuity of care document is there might be family history that's documented elsewhere that you don't have in the EHR, or social history that's documented that you don't have in the EHR. If there are medications that are here that she's getting from an outside somewhere else, maybe she saw a specialist, or maybe she's still on that Cipro and Flagyl for her diverticulitis, I have the ability with this green arrow where I can pull those in quickly into the EHR, or the clinic staff that's rooming the patient can pull that in quickly into the EHR. As well, I can go and import results. So I can pull in any of those lab tests that come back in, so that those will be part of the grid for me to use as I review lab work moving forward, and I'll have an indicator to know that they came from an outside source as well. So continuity of care document allows you to fill in the gaps in between visits that you've had with your patients. So a couple of other things that I want to point out as I'm doing a chart review on Miss Branham before I finish my note is that we have what's called care guidelines. This allows you to manage gaps in care for your patient. These are driven by health maintenance and disease management, and we deliver these out of the box. As well, you can configure your own. These are evidence-based, so I can go to the link here and see the reference behind it. But it shows you in red. I say anything in red screams at me to get my attention, to make sure I'm staying up to date with everything on all of my patients. This lets me know what's due. I can order from here. I can check the box and order from here, or I can easily order from CPOE, which is what I'm going to do as I finish my note. But gaps in care, clinical guidelines are here to help you keep up with all of your gaps in care. And we also have NextGen Population Health and Analytics. You'll notice this ribbon here. That is a solution that is outside of the EHR. I call it the Big Brother view. It pulls in information from your EHR as well as other resources, maybe from your local hospital, maybe from your local HIE, from other EHRs, from adjudicated claims from your payers, for example. So I call this the Big Brother view. I'm able to launch this at the point of care. I can see gaps that have been addressed. I can see gaps that are near due. I can see gaps that are past due or failed gaps right here at my fingertips, right here at the point of care. There are also risk algorithms embedded in our population health and analytics, which give me a risk score based on those calculations. So I just wanted to point that out. Not all of our customers use population health and analytics, but if you do, it's available right here at the point of care. Otherwise, you have care guidelines that are part of the NextGen EHR right here at point of care as well. So now I've done all of my chart review on Miss Branham. I'm ready to document. I want to point out first that I need to document some narrative here. You're able to free text anywhere throughout the SOAP note here. I want to put some narrative in around her diverticulitis. I've copied and pasted that just for the demonstration, but this is where you free text. You have one of these under each of the cards: the reason for visit, the physical exam, and the review of systems and assessment and plan. I just wanted to show you, I've documented the fact that she's here for chronic condition follow-up, needs refills, and about her trips to urgent care. Now, to address all of her chronic conditions, I use the chronic conditions template. I love this. It's a problem-specific documentation, and it makes it easy for me to hit and address each of those chronic problems. So if I come in and I select her diabetes, she takes metformin 500 milligrams a day for that. I can see my last note here. If I want to pull that last note forward, I can. If I want to document some standard, well, for now I'm just going to pull that note forward here. I can make some updates to it if I need to. If I want to say that we're going to continue on current regimen, I can do that. We also have tools here called My Phrases. You can build My Phrases so that you can just pull in some standard verbiage. Chronic condition, I'm going to continue her on current medications and go from there. Next, I'm going to go and address her hypertension. Again, I can pull forward the note from last time, make updates to it. I've got My Phrases here. I always ask, are you monitoring your blood pressure at home? Any chest pain, headache, shortness of breath, edema, etc. I can pull in that standard. If I need to make any updates to it, I can. Again, My Phrases, chronic condition, she's stable. We're going to continue her on her current regimen. I know that in the real world, they're not always stable and we need to make adjustments. So I might come in and make some updates here and just free text. But the point being is that this allows me to quickly and easily document and address my each problem when it's a chronic condition follow-up. So I'm going to go ahead and just document a few more of those, and I will finish with the chronic condition template. And because I did that chronic condition template, as I move to assessment and plan, you're going to see that I was able to kill two birds with one stone. So as I navigate here to my assessment and plan, you'll see as a result of using that chronic condition template, I kill two birds with one stone because it automatically pulls in those assessments that I added, as well as my what the plan is. So really helps to streamline the documentation of your chronic conditions, problem-specific charting. Now, a few other things I need to do here. I'm going to come to my review of systems. I have a default review of systems, several different default review of systems. I'm going to pull in my standard, and then I can go in and chart by exception. If there's anything that I need to update, if there's something going on respiratory-wise, I can go in and chart by exception. She's not having any abdominal pain today, even though she was recently treated for diverticulitis, so no changes there. And if I need to, I'll do the same with my physical exam. I have my normal physical exam. I might have a brief physical exam, etc. I will just pop in, quick load that standard, and I'll go in and make any updates. I did do a diabetic foot exam on her, so I'm going to quickly go to the diabetic foot exam template and update that and document and pull that into my note. Now there's a couple of other things I need to do for her. I need to refill her medications. So I'm going to come to the medication module, launching it again right from my SOAP note. A couple of things that I want to point out. I'm going to say for the story here that her A1C's been increasing and we need to increase that metformin. So I'm going to come renew edit to show that you do not have to cancel or discontinue the 500 milligram to increase to the 1,000. You can save it, and it's going to update from 500 to 1,000, and it's captured in the history here when you've made the dose change. So that's very efficient with respect to the medication module. And I need to refill all of these medications. So now I'm going to come in and renew them. The other ones, I've already renewed the metformin all, and send those refills off. So you can batch renew, batch refill the medications. And then one more thing that I'm going to do for her, just to show you prescribing controlled substances. Let's say that she's had a little nagging cough at night, nothing that I'm concerned about. I'm just going to give her a few Tussie caps, a few days worth of Tussie caps to assist her with that so that she can sleep. I just want you to see our workflow with the PDM to send this off electronically. With integration with Apris Health, we're able to pull up that PDMP report right here in the prescriber workflow, see controlled substances that have been prescribed previously over the past 12 to 24 months, as well as the providers that have been prescribing them and the pharmacies that have filled them. Once we review that, then we can continue to go to the dual authentication screen to do our prescribing. So as I continue, it's going to bring me to the dual authentication screen. This is going to be where I put in my password for NextGen, which is good. You don't have to remember an additional password. And then I use the Semantic VIP app. It's a free download on your smart device. It also can be on your desktop or your laptop. This is going to give you your dual authentication code. You also can use biometrics through Imprivata. But once you authenticate, you can send your prescription off. It's going to be captured in an audit trail that you reviewed the PDMP before prescribing and which medications, which controlled substance you prescribed, as well it will be documented in your note. So now that I've completed all of my prescribing for Miss Branham, I need to do one more thing. I need to place orders for her. So to enter, well, actually, I need to do two things. I need to go in and add an additional assessment for diverticulitis. So I'm going to come to Intelligent Medical Objects. That's integration that we have with search for your assessment. So as I go in and type in diverticulitis, this gives you a real nice, easy to use dictionary to use for searching for your ICD-10 codes. It gives you drill down so that you can get right to the specificity that you need for that specific ICD-10 code that you need. As well, you'll see the patient's problems with their HCC indicators, the billing history, and you'll have favorites to choose from as well. Now I want to sort my assessments, the order. I'm going to make diverticulitis the number one thing because I need to get her referred to GI, type 2 diabetes because I made a medication change, and then I'll put everything else in the existing order. And then the last thing I need to do is my ordering. We have the CPOE bar up top here. I'm able to come here to order search. The system remembers my ordering pattern. I order lipid panels and A1Cs all day long, so that's naturally up top so that I can quickly go in and select those for ordering. I can type in a few characters here in the order search and it will pull back a return. I can save favorite orders, so I could have different categories of favorites that I might save here. I also have my immunizations here that are attached to the CDC recommended immunization schedule to make it easy for me to know what's due and easy to order. Now I've got the lipid panel and the hemoglobin A1C ordered over here. She's on Medicare Part B, so I need medical necessity. So I need to attach her diagnosis. They're conveniently here at the bottom. If I go and attach the hyperlipidemia, I'm going to get the green smiley face that lets me know that medical necessity has passed. I've got the red frowny face because I haven't attached the appropriate diagnosis for the A1C. As I go and attach that diabetes, I get the green smiley face, so all is good to go. I can leave these in the shopping cart for my MA to address when he or she checks out the patient. Otherwise, I can place them myself. Nonetheless, when I'm done, it takes me from the CPOE bar back to the SOAP note so that I can finish up my note. I like to point that out because I don't lose my spot. It brings me right back to the exact spot that I was. And I am going to do one more thing. I need to refer her to gastroenterology. We have the largest direct messaging address book in NextGen, part of our interoperability platform, which allows you to search for providers by name, org name, MPI, specialty, location, city, state, or zip code. You can also give a gold star to those that you refer to on a regular basis. I refer to Dr. Albert here all the time, so I can just go in, pull that in, attach my diagnosis. I can send the task to the referral team or to the designated resource in my office that manages referrals. I can attach my documents that I want, or my staff can attach those documents that I want to send, and then that referral can be sent electronically. And now it's documented in my note that I'm referring her to GI, and I sent the task to my referral coordinators. So now I am truly finished with Miss Branham. So the last thing I'm going to do now is come back to my Finalize tab to document my E&M coding and generate my note. So again, we've got the new guidelines from CMS and AMA. It's based on E&M coding or time spent with patient, moderate complexity, and 99214. Yes, but let's say I spent 40 minutes with her. If I come in and change it to a time spent with patient, then it changed it to a 99215. Again, you're able to submit that code right to practice management. And then in the real world, your note will generate in the background. But for the demo, I'll go ahead and generate my note and then move back to my Grand Central Station. So far we've done a lot. I've oriented you to the EHR, the layout of the EHR. I've gone through several patients, showing you the ease of use of documenting using quick notes where those are appropriate, such as with that UTI. I said it's also good to use them with well child visits, for example. Those can be built at the practice level as well as on the fly at the user level. I also talked about quick loads, such as that standard review of systems that I used and that standard physical exam that I used for my chronic condition follow-up, all affording you the ability to chart by exception, thus streamlining your documentation. I used that chronic condition template, which allowed me to quickly and easily pull forward notes from past visits, document, make updates as needed on my chronic conditions, as well as it killed two birds with one stone by documenting my assessment and plan for those as well. And I showed you how you can do narrative in each of those cards, the HPI, the review of systems, the physical exam, the assessment and plan. And then I showed you the ease with which you can prescribe. changing doses without having to discontinue one dose and write a new prescription, refilling multiple meds at one time, and I showed you our workflow with APRA's help to show how the PDMP comes up during the prescriber workflow for review. Now that is available in most states. There are a few states that do not have that have not integrated with APRA's help yet, but NextGen offers that workflow when your state adopts APRA's help PDMP integration. And I showed you the ease of ordering with our CPOE bar. Now it's the end of the day. I'm going home and I'm going to show you how you can use our mobile app as an extension of your EHR. And this is our Complementary mobile app. To introduce you to our mobile app, I just want to first state that it's available for use on iOS devices as well as Android devices. I have both my iPad up and my iPhone. I'm actually at home and I'm just going to work from my iPhone. So I'm going to switch and show you just that screen. Now let's say I've gotten a call from the answering service. I'm actually on call tonight and I've gotten a call from the answering service to call one of our patients back. So I just pull my phone up out of my pocket, out of my purse, or most of the time it's glued to my hand. So I log in. It is cloud-based. It is not none of this information is on my cell phone. It's coming down from the cloud, and my PIN that I just used is attached to my NextGen login. So there's nothing special that I need on my iPhone other than to download the app from the App Store. Nonetheless, just to get you oriented here, when I log in, it brings me to the hub. The hub equates to my inbox, which you heard me refer to multiple times as my Grand Central Station. I have that PAQ here where I can review labs and sign off on them. I can make notes, I can reassign. So I can make a note here, I can reassign if need be. I also have access to my prescription refills. So I don't have to be attached to my laptop or my desktop to go and address refills that the staff has forwarded on to me to review. I can go and access the refill request coming in from the pharmacy. I can approve or deny. If I need to review this patient, I don't remember them, I can come to their patient details screen. I can look and see at their past and future appointments to see if they've been compliant. I can look at that medication list. I can look at their last couple of HPIs. I can see vital signs. I can see lab results. So I have all of that information right here on my cell phone, and I can either do the approve or deny. I also have my regular tasks. That might be phone calls or other tasks that the staff has sent to me to review right here as well on my cell phone. So an extension of the EHR. I don't have to be attached to my EHR to review that information or pull up a patient's chart. So I need to pull up David Cross because the answering service has called and said that he would like for me to give him a call. So I've pulled up his chart. He's actually calling for a persistent nagging cough. He was seen within the past month, and he had workup. He was negative for COVID. His chest x-ray was normal. I'm able to see all that right here on my phone. I can see that he had the extensive workup and it was, just deemed viral, but not COVID. Everything looked good, but everything's cleared up, but he has that nagging, dry, hacky cough that he needs a little bit of assistance with, especially at night. I can also see here that he has an alert on his chart, so I'm able to pull that up. He's actually seen in our behavioral health division, the behavioral health side of the house, and he has history of alcohol abuse. So that's great information for me to have, especially when I'm on call and he's asking for something for cough. So with that being said, I know that I'm not going to give him a controlled substance, but I'm just going to go in and give him some Tessalon pearls. My favorite medications are those meds that I prescribe on a regular basis that you saw over in the EHR. They're here on my mobile app. So I have Tessalon pearls saved. as one of my favorites. I'm going to go ahead and give him 30 and send those off to his pharmacy, and I'll let him know. So there's his preferred pharmacy. As easy as that, I'm sending that off, and that medication has been sent. So that gives you a brief introduction to our Complementary mobile app. It is an extension of your EHR. You can use it in the clinic. You can see how it can be of great use when you've gone home and maybe you had some tasks that you needed to address but just wanted to do it in the comfort of your home with your family, as well as having access to your patient's charts when you're on call. There's no worse feeling than having to address a patient and not have that past information on them right at your fingertips, and our Complementary mobile app solves that problem for you. So I appreciate your time and attention to this little demonstration. We look forward to spending more time with you and giving you more look at NextGen in the future. Thank you so much and have a great day.